STATSWAB is a new and innovative, fully integrated, on-site oral fluid drug and alcohol testing device. The STATSWAB is easy to use and provides fast and accurate results. In this video, you will learn and observe the advantages of the test, how to store and administer the test, how to interpret test results, how to document test results, and what to do when confirmation is needed for preliminary positive test results. Advantages of the STATSWAB. There is no need for a restroom, as STATSWAB testing may be conducted in an office or in the field. Sample collection is observable, reducing the instance of test tampering. Oral swabbing also eliminates the privacy issues associated with urine testing. STATSWAB offers a simple swab and read procedure. The device may be shipped to a lab for confirmation testing. STATSWAB also offers the broadest range of drugs and alcohol testing available in an on-site oral swab. Employees may be tested once for an array of substances without ever leaving the worksite or office. In addition to the STATSWAB Drugs of Abuse test, the STATSWAB Plus will test for alcohol as well as drugs. STATSWAB packaging, storage, and components. STATSWAB tests are packaged in boxes of 25 and also include an instruction card and package insert. Each test is packaged in a sterile foil pouch and labeled with the product part number, the drugs and alcohol to be tested for, an expiration date, and a production lot number. Each STATSWAB includes a collector cap and sponge, as well as a collection chamber with built-in test strips. On the label, you will notice a results key for quick reference. The label also has an area for the donor's ID number and the date. The STATSWAB also includes a perforated removable label that allows the administrator to view the test results. Test strips should be visible in the test window, where test result lines will appear for interpretation. Each strip is also labeled with the abbreviation for the corresponding drug that it will indicate for. To properly store STATSWAB tests, keep them at room temperature. Do not expose tests to hot or freezing temperatures for a prolonged period of time. Adhere strictly to the expiration date on the foil pouch, and do not use tests beyond that date. Also avoid opening the foil package until it is time for the test to be performed. Administering the STATSWAB. When you are ready to administer the STATSWAB test, instruct the donor to refrain from placing anything in his or her mouth for at least 10 minutes before collection. This includes food, drinks, gum, and tobacco products. Use this period to go over paperwork and instructions with the donor. A sip of water may be allowed to those donors who complain of dry mouth during this period. If this is needed, have the donor drink from a water fountain or unopened water bottle while under supervision. Step 1. When the 10-minute waiting period is complete, select a test device and verify that it has a valid expiration date. Open the pouch and remove the test only when you are immediately ready to administer the STATSWAB. Once the pouch is opened, label the testing device with the donor's ID number and the testing date. Have the donor remove the collector cap and sponge from the collection chamber. The sponge will be hard initially but will soften as it absorbs the saliva. Step 2. The donor will then insert the sponge in his or her mouth and begin actively swabbing continuously for 3 minutes. Inform the donor that he or she may experience a sour taste after the first minute. This is meant to aid in the salivation process. To saturate the sponge fully, instruct the donor to swab areas where saliva is pooling, including under the tongue. The donor should not bite or chew the sponge during the collection process. Step 3. At the end of the 3 minutes, the swab must be completely saturated with no hard spots remaining. When the swabbing is complete, ask the donor to insert the sponge into the collection chamber and screw on the collector cap until it is secure. Step 4. After the cap is in place, peel off the label to view the results. You should notice a pinkish color migrating or flowing up the test strips as the test begins to run. You may interpret the test by viewing the lines in the test result window. Negative results may be interpreted as soon as they appear. Wait 10 minutes for preliminary positive results to fully develop. Interpreting the STATSWAB. To interpret the results of the test, look at the test result window. There will be a control region along the top of each strip and a test region along the bottom of each strip. Interpret the presence or absence of the line in each region. One red line should appear in each control region under the corresponding drug abbreviation. This is an indication that the test has run properly. If the donor tests negative for the substance, a second red line should appear in the test region. Any line that appears, regardless of color intensity, should be interpreted as a negative result. After 10 minutes, if a second line has not appeared in the bottom test region, this should be interpreted as a preliminary positive result. Any positive STATSWAB result should be considered preliminary and should be confirmed by an alternative method. Refer to the STATSWAB Plus color chart to determine the presence of alcohol in the sample. Compare colors to determine the approximate level of alcohol. If the control line fails to appear, the test should be regarded as invalid. This is usually due to an insufficient amount of oral fluid being collected. If the line fails to appear in only one test strip, try tilting the testing device slightly toward the invalid strip and tapping the bottom of the device lightly on the table to facilitate the flow of saliva to the area. This should help break up any air bubbles that formed in the saliva. If tilting and tapping enables the saliva to flow up the strip, continue to interpreting results. If tilting and tapping does not work, do not record the invalid test result. Instead, discard the test, review the collection and testing processes, and repeat the test with a new unused device. Documenting the STATSWAB results. When you are ready to document the STATSWAB results, complete a preliminary form, which is available in carbon copy and electronic format upon request. Complete the applicable information on the preliminary result form. After completing the preliminary result form, the preliminary positive sample should be sent to a laboratory for confirmation. Procedures will vary depending upon the lab of your choice. Consult with your lab or service provider regarding chain of custody forms, security seals, shipping supplies, and additional training. If you elect to confirm using the STATSWAB device, then a second collection should be taken to ensure that enough oral fluid is available for testing. In this situation, use another STATSWAB collector cap, sponge, and collection chamber without test strips to send to the lab. An alternative confirmation test may be conducted with urine. Contact your service provider for further assistance. For more information or technical support, call toll-free 866-933-0964 or visit our website www.micro-distributing.com.